Okay, hi MPH families, Dave McCusker on Friday afternoon. I hope everyone's doing well and enjoy the long weekend coming up. I wanted to share some comments and some context on the importance of our daily health assessment, as well as the importance of doing a very accurate attendance for all members of the community every single day. And I realize these are extra steps for our families, so we are sensitive to that. As far as context is concerned, you might be interested to know that for us to do these protocols really well, it requires a lot more staff members and staff hours. And so I calculated this for the first time. So here's what I want to share with you. Every morning we have 27 different people involved in these various protocols. We are conservatively dedicating just over 1,000 minutes every morning just to this process of welcoming all members of the community to MPH in a safe and healthy way. If you translate that to a 1 week period, it translates to about 88 hours of staff time each week to ensure that we're doing this really, really well. And we need to do it well. It's very important. And so just as an example for the daily health assessment, we've learned, as we have in a lot of other areas, that it's serving a very important purpose, and yet we want to modify it somewhat to do two things. And you'll see this probably starting next week. We're adding an additional symptom that is important to helping us detect the possibility of COVID-19. We're also putting in two things in terms of a sign-off that parents are completing this and not students. We've tried to make this clear before. We have to make it crystal clear. Some of our students are coming in and saying to us that they're completing the daily health assessment, and that just is not going to be acceptable for us. We have to ensure that our parents and our guardians are participating in this process. The other part is that we have to really separate any notion that the daily health assessment and the attendance process are in some way tied together. We were hoping that maybe we would find an elegant solution to do both in one time. It's just not possible. And so we're going to make clear that the daily health assessment is for just that, assessing the daily health of the community as represented by each individual. The attendance process has to be a separate and distinct process. And we're doing this for obvious reasons related to the pandemic. We also have a reporting requirement to the state of New York, to the Department of Health. So every day we're reporting this information to the Department of Health. But fundamentally, we feel that if we want to continue with this education in this way, we have to be disciplined in these processes. And so for that reason, I really appreciate your participation and your partnership. We have started to conduct an all-school meeting every Wednesday morning, and I get to share some comments with the entire community, including your children. And one of the key concepts this Wednesday was the idea that, a chain is only as strong as the weakest link. And the point here is that each of us as individuals has a responsibility, not only to ourselves, but to the larger community. And I think the kids are doing a really nice job. They're making some adjustments. We've got some areas that we're working on. Physical distancing continues to be a challenge for us. We as a school are taking some additional steps to help with that. But fundamentally, this is a cultural shift, which is the hardest part of making any kind of change. We get it, old behaviors and so on, and we all have to do new things. But the stakes are really high. We're taking this very seriously. In the country, as of yesterday, 22 states reported that they're seeing increases in COVID-19 cases. We're over 200,000 deaths in this country as it relates to this particular illness. The state of New York got hit really, really hard in the early months of COVID-19, especially in the New York City area. And yet the state has done a great job, I think, putting in protocols that have helped to not only flatten the curve, but to really manage this well. In our county, and we're monitoring the health of the surrounding area, our rate of positivity, or the percentage of positive results to tests is under 2%, which is a really excellent level, and it's been that way for a long time. In our community, every member of the community who is here is being screened, and so we're following up on that. There are probably 5 to 10 cases every morning where we have to be in touch with families to confirm the daily health assessment for those children. We know that that is maybe an annoyance to some families, and we apologize for that. That's not our goal here. Our goal is, as it is for you, a healthy and safe environment in which we can conduct this education. And so while it might be bothersome to get a call maybe at work, we apologize for that. But please, if it's helpful for you to understand the larger context here, I hope you can understand why we're reaching out this way. So it's a lot. I get it. We're trying to do a lot here. We're sharing a similar goal, though, and we feel your partnership. Our MPH families are the best, and I'm grateful to all of you for what you're doing to work with us to educate your children and to keep them safe and healthy and well. All right, thank you, and have a great weekend, and we'll see you on Tuesday. Bye.